Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. And yourself?
I'm living it up. Why not?
I was hoping you'd say that. Well, we want our listeners to live it up, and since the name of the show, as you just heard, is Living Pain Free, that's our goal. And this program is about orthopedic pain or musculoskeletal pain. What does that mean? It means muscle pain, joint pain, tendon pain, ligament pain, disc pain, back pain, neck pain, knee pain, hip pain, arthritis pain, and perhaps you have carpal tunnel syndrome or tendonitis. Maybe you have stiff joints or dull aches and you don't really understand where it's all emanating from. So you can call us all hour long and speak directly to Dr. Darrow about your pain at 866-870-5752. That's 866-870-5752 right here in the studio. And I invite you to check out Dr. Darrow's website at www.lastemcells.com. That's lastemcells.com. You can email him off of every page on the site and watch Dr. Darrow performing these treatments on videos. Again, that's www.lastemcells.com. We're here Saturdays at 10 a.m., again at 1 p.m., and the biggest surprise of all is when you call the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate, with over 250 scientific studies. The foreword is written by the lovely Suzanne Summers, and we want you to have that book, study it, and consider regenerative medicine. Because remember, the byline of the show is we take the surgery out of pain. So it's all about regenerative medicine today. Do you want to say more about that, Dr. Darrow?
Sure. The byline of the book, Stem Cell and Platelet Therapy, is Regenerate, Don't Operate. And that has been my entire medical career, which is to stimulate the body to regrow tissue instead of having needless surgeries. And I know that's a shock to a lot of you. What does that mean, needless surgeries? Many people in the musculoskeletal field, I'm going to make up a ridiculous number. It may not be accurate, but it's been my experience. About 99.99% of people who have a surgery for musculoskeletal issues don't need it. There are many people that do need it. If you have a broken leg, you better get to the doctor. But if you have a meniscal tear in your knee, rotator cuff in your shoulder, something of that nature, you do not need a surgery in most cases. And unfortunately, my office is filled with patients who have failed surgeries. That means they had a surgery, it didn't work out well for them. And a lot of you folks who are listening are my patients who have had a failed surgery, and you know what I'm talking about. That doesn't stop us from healing the area. But the problem is you never needed a surgery to begin with. So be careful. Surgery is invasive. There's many potential side effects. The most common that I see are people that get infected or just have more pain. But I have seen people die on the table and die later. I know that's radical, but it happens from very simple surgeries that that shouldn't happen to. So be careful. Always get a second opinion from doctors who want to do surgery, but don't go to the same kind of a doctor to get a second opinion, because you'll get the same opinion. Go to someone in a different field. If you've been to an orthopedic surgeon or a neurosurgeon, think of going to a physiatrist. That's someone who does physical medicine and rehabilitation, as an example. They are looking outside the box to get you healed without surgery. And that's what my residency was after medical school. I did 4 years in order to learn how to do healing in musculoskeletal medicine, which means anything really from the top of the head to the bottom of the feet and in between. So neck pain, back pain, arthritis, shoulder pain, elbow pain, muscle pain, hip pain, knee pain, ankle pain, toe pain, finger pain. We treat all of those kind of things, and we are busy doing it. I'm told that I'm the busiest guy on the planet, but being in LA, of course, that makes sense, right? Los Angeles is very, very dense with people. But there are guys doing this all over the world, but be careful who you go to. I always tell people when I refer them to a doctor, because I don't do everything, I just do what I do. I say, make sure you ask that person how many of these procedures they did today or yesterday or the day before, okay? You don't want someone who's dabbling in a field or spreading themselves out too thin. That's disaster waiting to happen. So I'm going to ask for some phone calls right now, and if you could write down, get a pencil and paper, you can write this down. We are at the studio, which is at 866-870-5752. That's 866-870-5752. I know we have Lorena waiting about her low back. Lorena, thanks for calling. I'm just going to give out my office number also, in case you're too shy to call in. I hope you're not, because we love our callers. But if you want to call the office anytime, and there are people typically by the phones all the time, if you don't get someone to pick up, it means they're busy. You can just leave a message with your phone number. We'll get right back to you. And the office phone number is 800-300-9300, 800-300-9300. So Lorena, this is Dr. Marc Darrow. I understand from what you've told the call screener that you have low back pain. How long has that bothered you for?
About a month and a half.
Okay. And how did it start? What happened?
I do animal search and rescue, and I was unfortunately jumping a wall, and I fell, landed in the concrete drainage.
Okay.
And then my hip was sore, but not too bad, and I ended up in urgent care later that night.
Okay.
And they did x-rays, and they said they found a transitional lumbosacral anatomy enlarged right L5 transverse process.
Okay.
I'm in chronic pain day and night.
Okay. I'm so sorry to hear that.
Thank you. I'm actually waiting for my insurance. They did a mistake, and I was supposed to see a doctor yesterday, pain management. But I've been doing on my own, going to physical therapy. But it's anything I do, any movement I do, I'm in. And I'm not a pain person. I can tolerate pain, but
Sure.
it's normally between a 5 and a 7 all day, all night.
May I speak a little bit?
Yeah.
Okay. So what they found on the x-ray is 0. Okay. What you have is it may be different than other people, but it's not something that causes pain. So you can forget about that x-ray as giving any information as to a problem. X-rays show bones, basically, and you might need an MRI, but not so quickly, because you didn't mention any pain down your legs. So you don't have pain in your legs, it's just lower back pain. Is that correct?
Correct.
Okay.
It does go into the groin area, but not down the leg.
Okay. If it does go into the groin, I have to check that, because you may just have what's called a sports hernia from that fall, where the adductor tendon, those are the big muscles in the middle of the legs, attached to the pubic bone. That might be sprained, and that's something we can help by regenerating that tissue by using platelets from your blood or platelets and stem cells from your bone marrow. Those are the two things that I do right now. So I'd have to touch that area and see what's going on. I'd have to touch your low back, see what's going on. At this point, I don't think you need an MRI. I think that the x-ray shows us there's no fractures or anything, so that's important. And most likely you have a sprain. Now, being an animal search and rescue person, have you ever sprained your ankle?
Fortunately, no.
Okay, well, people who sprain their ankle,
This is the first.
sure, people who sprain their ankle report that they have miserable pain, okay? But that doesn't mean they get nervous about it because it's a sprained ankle. When it gets into the back or the groin, then doctors go crazy in a sense, and they start thinking about surgery because there's nerves back there, there's the spinal cord, there's all kinds of stuff. But most problems that people have with low back pain are really in the ligaments that hold the bones together. So ligaments attach bones to bones. They're pieces of collagen that do that. And then tendons attach muscles to bones. And where that attachment is Nita's favorite word, enthesis. So when you sprain that area, it's called an enthesopathy. Pathy just means disease, but it doesn't mean like a disease that makes you sick necessarily. In the musculoskeletal system, it just means that something is sprained there. And those are the kind of things that I work on all day long, and people get better very, very quickly usually. So if you do want to call the office, I'm going to give out that number again. It's 800-300-9300. And I can tell you in about 2 seconds by touching the area if I can help you, okay? I don't need imaging. I don't need imaging, fancy, expensive imaging to tell you. If there was something I thought you needed to be done, like get an MRI, then we would talk about that. But from what you're telling me, you don't need that, and you're not in a lot of trouble, okay? Again, you're not my patient. I'm just reporting back on the radio from what you've told me that you're in pretty good shape.
Yes, I think so.
And if you're not, are you getting any better in the last 6 weeks?
No.
Okay. Yeah, if you haven't healed in 6 weeks, then it's it's getting into an area where you might want to think about treating it with PRP, which is platelet-rich plasma, or if we think it's severe enough, using your bone marrow that has stem cells and platelets in it. Okay?
Okay.
Are you good? Do you have any other questions, Lorena?
No, that was it. That's it.
Okay, good.
Thanks for your call, Lorena. We appreciate it. Our number here in the studio is 866-870-5752. That's 866-870-5752. Shall we go to Richard in Chicago?
I'd love it. Richard, Dr. Marc Darrow. I'm from Chicago.
Yes, I think you're a Northwestern grad, aren't you?
I am. It's a gorgeous campus right on Lake Michigan, just north of Chicago.
It is. Yes, we're about the same vintage, though you look better than I do.
I fake it.
He's only 17.
16. Don't push it away.
I'm sorry, I confused.
So, Richard, what's going on with you? Your thumbs bother you? How long has that been going on for?
Well, it's gone on for probably 5 years. I was actually supposed to be in your office last month, but I had to put my mom in hospice.
Oh, I'm so sorry.
And she did end up dying.
Oh, okay. God bless you, and God bless her.
Well, thank you. So, yes, so I have probably an unusual question. I'm a golfer, as you are, and rather passionate about it. And I'm wondering, am I doing myself a disservice by playing out the golf season here in Chicagoland and then coming to you, say, November, December, or should I be coming to you because I don't really know how long the recovery time is after the stem cell injections?
Well, that's kind of personal preference. I haven't seen your thumbs to know what's going on. Have you had X-rays or MRIs to assess anything?
I have, yes, I had them in October. It shows osteoarthritis at the base of both thumbs. I'm right-handed. I'd say it's actually a little bit worse on my left thumb.
So,
And I did have,
if you're continuing to play golf, it's obviously not killing you, right? It's like you're sore, but you can do it. Sometimes getting clubs re-gripped with thicker grips can help that too. I don't know if you looked into that. They have arthritic size grips that are oversized. They just put some extra wraps around the club. You're aware of that?
yes, actually, I do have those big grips. And I did, 2.5 years ago, I did have PRP injections. And the benefits were very good. They didn't last, and I had them again about 7 months ago without any result.
Okay.
So it worked the first time, not the second.
See, the thing about it is it did work the second time. You just didn't get the results you wanted or your expectations. The reason I say it like that, I'm not being facetious, but when we inject platelets into the body, it stimulates tissue to grow. That's been proven, by doing biopsies before and after in certain parts of the body. It's not really relevant to you that it worked in that sense because you didn't get the results you wanted. Okay, I understand that. But it does work. The question is, how much do you need so that you feel better? And that's a question no doctor can answer. So on my body, since you know my story a little bit, it sounds like, I've injected both my shoulders with stem cells and platelets, both of my knees. I've done both my elbows, my right wrist, my neck, and my back. And the stuff on my neck and back, I don't do myself. The other stuff on the front of my body, I can inject myself. And sometimes I heal overnight, where I'm completely pain-free with full range of motion. And sometimes it takes several treatments to get better. I don't know why that is. I really have no clue. It's just the way it is. So every single patient that comes to me, his first question is, how soon will I feel better? And my answer is always, I have no clue. It's a terrible answer, but it's the truth. And then people say, why are you so honest? And I go, because that's the way I am. They go, why aren't you my cheerleader and tell me it's going to get better quick like the surgeons told me before? Because I don't do that. We get way too many people that come in with failed surgeries who are told they're going to heal up quick. 3 weeks, 3 months, whatever, and then they're worse. I don't do that. So I'm very particular about letting people know the truth, which is I don't know how you will feel after treatments. It's a terrible thing to tell people, but it's the truth.
Sure.
So
sure, but
my guess is if you had results that you liked with the doctor that you used before and you're in Chicago, you may just want to finish up with him and just get some more treatments and see if it works for you. Or you may want to consider coming out here and having me do stem cells on your thumbs, because that is more effective. You have more healing techniques going into you than just one, which is the platelets. Do you understand what I'm saying?
Well, I think that's what I would do, because I've heard that, the doctor I had never done thumbs before, and I think you do thumbs every week, if that's not...
Well, I do thumbs all the time, yeah. Thumbs are very common injuries, overuse injuries.
And if I came to you and I had the stem cell injections, now I want to abide by what you say, and what kind of, how long, say, would you ask me to wait before I would do golf again?
That's a hard question. I haven't seen your thumbs yet. But generally, I have people come back in 2 weeks to assess how they're doing. And you're far away, so this won't be as easy for you. But it depends. Some people fly in from other countries once a year for treatment. They're not coming back every couple of weeks. If you were living here or you're on vacation here, which a lot of people do, they'll come to LA because it's nice weather and they'll stick around for a while. I've had people come for, a month or so, or a couple months even, with terrible conditions. and they'll get treated every couple of weeks. I've had some people will come in for a week and get treated every day. So there's no exact rhythm to this. It depends on the patient and their schedule. So a lot of doctors who don't really know what they're doing will treat every 3 months or every 6 months because they read some nonsense science which says that's how long it takes to mature the tissue. What I find, because I inject people at all different periods, depending on what their needs are time-wise, I find that if people are injected, on average about every couple of weeks, that's a good rhythm for them. If they don't get better the first time, then they re-inject again. But people who are aggressive and need to be healed very quickly, if you're an elite athlete or you're just someone who says, I've got to get back to that golf course, you might want to come here for a week and get injected a few times.
Right. Well, I do. Golf is important, but I can golf and I can play the piano. But tying my shoes, using tools around the house, those are some things that I can't do that I want to get back.
Okay.
So I won't be satisfied until I can do repair jobs around the house again. And so I do go to Arizona in the wintertime and
Well, it sounds like you're
so,
leaning toward waiting, for the golf season to end and then coming out, and that's fine too.
Well, I kind of do, as long as you don't think I'm, hurting myself, damaging.
Well,
things.
you've been hurting yourself since the day you were born, and you're still alive. So I don't know what that means. I mean, it's up to you. You have an overuse syndrome, and golf is probably one of the causes of it. Piano is high on the list, and no one likes to hear that they should stop doing what they're doing for a while until they feel better, because in my language, healing is very inconvenient to people.
Yes. Well, I know for yourself, you're passionate. I think you hurt your knee at your golf course, and because you couldn't use carts.
Yeah, you know everything about me.
You healed up quickly.
Do you work for the CIA?
No, he's writing your biography.
Yeah, exactly.
No.
Yeah, look, I can
but
cheat because I can re-inject myself the next day. I can go out and do sports the same day that I inject myself afterwards, because who cares? I'll just re-inject myself if it doesn't feel better. But look, if you're flying around to get here, you'll want to relax a little bit and give it a chance for the tissue to grow in before you start beating it up again. What that is, we have to discuss after I examine you and see what's going on. It's different for everybody.
Okay. Well, I respect what you do, so you'll be the one that I'll come and see.
You're so sweet. Thank you.
I can.
Thanks, Richard.
God bless you, Richard.
You bet.
And thanks for working on Mark's biography. I think that's very generous.
Thanks for giving out all my secrets. All right, Richard, I appreciate you. I'm glad you're playing golf and still active. And, there's super good hope. I mean, those thumbs generally heal very quickly.
Wonderful to hear. You'll be the person that does it, doctor, and you'll see me either sooner or later. But I will show up, absolutely.
I'm looking forward to meeting you, and you can bring your piano with you so I can hear you play.
Maybe my golf clubs, but the piano's a bit heavy.
Hey, you know what we can do when you get here? I'll take you out to play, and then I'll inject you right afterwards. I don't know if you heard the story, Richard, but you know a lot about me. You may have. Back in the day when I was doing a lot of prolotherapy using dextrose, sugar water, which I can carry around in my car, I'd go to a golf course, I'd play, but oftentimes at the driving range, people would line up for me to inject them, and I would do it right outside.
No kidding.
Yeah, I'd never charge anybody. It was just kind of for fun. They were my friends. And It's a pretty amazing experience because it's easy to do the procedures, depending what it is. And, I'm going to be honest, man, most golfers are injured. Anyway, Richard, God bless you. We're going to break. I'd love
Thank you,
people to
Richard.
call in the studio right now and talk to me live. It's 866-870-5752. Give me a call.
You're listening to Living Pain Free with Dr. Marc Darrow. Write this number down, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.